Stress factors. When researchers talk about stress factors, they mean everything else other than genes, such as the conditions of your birth, exposure to illness, nutrition, social life, family experiment, drug use, and more. All of these things can cause stress. Scientific studies show that the brains of children and teens are 5 to 10 times more prone to stress than adults' brains. Risky business. Schizophrenia and psychotic disorders can be devastating diseases that affect your emotions and how you think and express yourself. They can also lead to harmful or risky behaviors. Smoking is very common with schizophrenia and psychotic disorders, as in substance and alcohol abuse. Schizophrenics are more likely to have severe medical issues such as obesity, high blood sugar, and diabetes because of the types of medications they take. They are more likely to self-medicate or use drugs as well. Depression is common as the disease progresses, probably because of the stigma of schizophrenia and its negative associations. Stress and stigma can make symptoms worse and sometimes lead people to self-medicate or use alcohol to cope. Suicide and psychotic disorders. Suicide is also a very real risk for someone with schizophrenia and other psychotic disorders, especially after a psychotic episode. Statistics also show suicide and ideation, or thoughts of suicide, occurs often within the first 5 years of the illness or within 6 months after a hospitalization. Suicide risks is often related to the medications used to control schizophrenic behavior, but the substance abuse, depression, and fear of loss mental abilities can also make someone feel like ending it all. About 20 to 50% of all people diagnosed attempt suicide at some point in their life, up to 13% succeeded. Our understanding of how the brain functions is constantly being challenged. Brain research helps determine new treatments for mental illness. Chapter 2, Diagnosis and Treatment. Mental illnesses are physical conditions that don't get better and don't go away without treatment. Although there is no cure for schizophrenia and psychotic disorders, with treatment you can live a healthy and productive life. Under construction. During adolescence, your body approaches a lifetime peak of health, mental ability, and physical strength. Your body, including your brain, is changing. Your emotions are fully functioning. Your ability to keep them in check is not online yet. Your brain is growing and works faster and more efficiently, yet some of these changes affect the way your body stays healthy. For example, adolescents and teens have a tendency to stay up late even though getting lots of sleep is necessary for emotional and mental well-being. Many mental illnesses have their beginnings in the growing brain. Understanding how the adolescent brain and body interacts and how the brain grows can help us understand why brain development can go off track and leave adolescents and teens vulnerable to mental illnesses such as schizophrenia and other psychotic disorders. What affects mental health? Mental health is a balance between all parts of your life: social, physical, financial, spiritual, and mental. As you grow, you learn what is right for you to maintain your unique personal balance. During this growing and learning process, there are many things that can push you off balance and challenge your mental health. Having a mental illness does not make you weird, freaky, or crazy. When your mental health is challenged, it's the same as getting physically ill. just being an adolescent can throw you off track. This is a time when your body and your no put that way. This is a time when your body and your way of thinking changes. More responsibility and maturity is expected from you, and this can be confusing and complicated. It helps to have an understanding doctor. I have a psychiatrist who I have been seeing for 10 years. He understands me and my disorder. Without him and my family, I would literally not be here today. They saved my life. Nathan, 27. Seeing a doctor. Not everyone notices changes in their thinking or behavior or may not connect any changes to a possible mental health issue. If you are concerned, you should see a doctor. Most of the time, the first doctor you'll see will be your family physician to make a diagnosis. He or she will ask you, and probably your parents, questions about your physical and mental symptoms and behaviors, such as if you've been experiencing hallucinations or delusions, or if you've been or if you've had any recent stressful situations. He or she will also ask you and your parents questions to rule out other types of illnesses and behaviors that can be similar to a psychotic disorder. They will want to know if you have been taking other drugs or drinking alcohol. Alcohol and drugs use can affect your mental health. Your doctor should be able to answer your questions about treatment, medications, and their effects. Take a trusted friend or family member with you to see your doctor. They can help you get the right treatment and support. Sudden psychotic symptoms. Sometimes if a person has had a sudden psychotic flare-up, they may be taken immediately to an emergency room at a hospital where they will be seen by a doctor or possibly a psychiatrist. A psychiatrist is a medical doctor who specializes in disorders of thinking, feeling, and behaviors. The psychiatrist will ask many questions and determine a diagnosis. Schizophrenia can alter brain structure and patterns, so the doctor may order tests such as a magnetic resonance imaging (MRI) or another brain scan. These tests may also rule out sudden brain injuries, or tumors as causes of the psychotic flare-up. Child psychiatrists or psychologists also treat adolescents and teenagers with psychotic disorders. It can be frightening to know you have a serious mental illness. Some people find it hard to accept. Types of treatment. Your brain is like any other organ in your body. It can get sick just like your kidneys, pancreas, or heart. And just like the rest of your body, your brain can be treated. The main goal of all treatment plans is to lessen your symptoms and even to playing fields for your own even the playing field for you. Some of the more common treatments include drug therapy, counseling, and recreational and social skills training to help get you back into a social circle of friends, family, and school. Research is showing that some newer types of treatments are also having good results. These include cognitive behavioral therapy, helps to find the things about yourself that bothers you by talking with counselors and setting goals. The way you think and do things can be changed from negative to positive. Peer support groups. Talking and sharing experiences with others in a group helps develop social skills. Treatment may be given on an outpatient basis. There is a severe psychotic period Treatment may be given during a hospital stay until you stabilize. Some people stay at in-treatment programs. These group homes or facilities are common for children and youth, especially if the psychosis is serious. When symptoms become less severe, they are treated from home. Tell it like it is. Counseling and therapy are important cornerstones in treating psychotic disorders, including schizophrenia. Therapy involves talking to a counselor to identify any negative thoughts and beliefs that make you feel bad about yourself. Once you understand these thoughts, the therapist works with you to change them into positive feelings that increase self-esteem and self-worth. That is why it is important to be honest with your counselor and therapist. Tell it like it is, no matter how crazy it sounds. Your feelings are honest, but the way you act on them may be appropriate. Therapists can help you recognize the difference. You may also want to mention how your medication is making you feel. Although your therapist can't prescribe medication, he or she can suggest ways to cope or refer you to your psychiatrist or for a medication review. Being honest with your psychiatrist or therapist is important. They are there to help, and it is difficult to shock them. There is nothing that they haven't seen or heard before. Psychotic disorder drug therapy. Psychotic disorders can be successfully treated with medication and counseling. It may take a few weeks for medication to take effect and to notice a change in your symptoms. You may also be prescribed different medications or a combination of drugs to find out which one works